had a conversation just the other day with a family where they were challenging their mom with, saying, "Do you remember me, Mom?" And unfortunately, it's very insulting to somebody that has a cognition problem or a memory impairment. It's kind of like you're challenging their intellectual level, and it's very, very demeaning to them. So the one thing I can pass along is not to ask your mom a lot of those challenging questions like, what did you have for breakfast today, Mom? Do you remember who I am? If we can avoid asking those people with any form of dementia a question, you're going to actually alleviate them with that burden of trying to remember that and thinking, "Oh, I'm stupid, ain't I?" And that's exactly how they feel. And again, we're leaving pleasurable moments of joy for them. And the one thing I can always pass along is please don't ask them questions, and you'll make your life so much better. We find that when we are helping those with dementia that they are declining and they are changing on a daily basis. They are declining. They can't correct what is going on with them. But those around them, those professional caregivers and family caregivers, we're going to need to change our communication methods, the way we live our lives to keep them safe and secure. So the one who's going to be changing the most as far as our personal behaviors and habits are going to be the family caregivers and the professional caregivers. Again, those with dementia, they're not able to fix what is going on. They can't change a bad behavior because they get a progressive disease. They don't know how to understand and can't troubleshoot. They can't solve problems, but we can solve those problems for them by changing our behaviors and habits.
For every caregiver providing services, paid or unpaid, caring for someone with dementia requires a specialized skill set. Debra Desrosiers has created the Caregiver Keys for professional as well as family caregivers navigating this journey.
1 out of 5 families is currently affected with Alzheimer's or a form of dementia. In the next 10 to 15 years, it's going to be 1 out of every 2 families. So it is a disease that's very much on the rise. Out of all of the diseases, that Alzheimer's is the only one has gone up. Cancer, everything else has gone down.
Debra is passionate about educating and empowering families and professional caregivers of those with dementia. Debra Desrosiers is a certified senior advisor, certified Alzheimer's Dementia Coach and consultant, and a nationally certified activities professional for home care. She has been the owner and director of Visiting Angels, a busy home care agency since 2004.
So explaining what dementia is again an umbrella. And it's very much like cancer. There's many different diseases under that umbrella, like breast cancer, prostate cancer, colon cancer. Dementia also has many different forms under it. What it is it's symptoms that people are going through.
The Caregiver Keys are training modules created to educate and empower those caring for people with dementia.
It's a journey, and within that journey it changes as the disease progresses. So what happens with the disease is early on you have that cognition and the early memory impairment, but as the disease progresses they're unable to do more for themselves. So you have to plan for the stages of them not being able to communicate, maybe them not being able to walk any longer. And I like to tell families to be proactive instead of reactive. Our families all need to determine who is the pack leader. There needs to be somebody in charge with this person with dementia. They need to be very close to them. They need to be a trusted person. And that person is going to be the person that helps coordinate their care and their journey in the disease. So look at how many children are available to be able to help you out. What are their specialties? Do you have a lawyer in the family? Do you have somebody in the medical field, etc.? Do you have somebody who can help maintain the home and is a great handyman? What you need to do is you need to look at that person's world and put somebody in those places. Very important that that environment needs to be safe, and you need to know within the environment things that are going to need to change. I'm just looking at the carpet in this room. Somebody with dementia All these little flowers or whatever is on the floor could look like ants to somebody. So those are things that people aren't aware of when you're dealing with Alzheimer's disease. When your brain's not working 100%, things are going to look a little odd. When you're working with somebody, we need to validate their feelings. So if they're sad, communicate with them. I'm sorry you're sad today. And instead of trying to sway them in different methods. So again, when you're working with somebody, we want to validate their feelings at any time. If they're angry, if they're sad, I'm sorry you're angry at me. Is there anything I can do to help you? Again, survival is very important, so you need to take care of yourself. So as we are doing caregiving, you have to be able to take a walk, get your hair done. You need to take time for yourself, because if you are caught up in this and doing it 24 hours a day, you're going to get stressed out, and that's where heart disease comes in and everything else, anxiety, depression.
Caring for someone with any form of dementia takes specialized skills, which are available through the Caregiver Keys program. These keys are available to families and professionals to help navigate the dementia journey. Coaching is available in person, over the phone, or over Skype. For more information, visit www.caregiverkeys.com.